Hi, my name is Stella Obedi, and I'm a student of Bragman University doing my Doctor of Nursing practice. And currently, I work in a family clinic as a family nurse practitioner. Um, the purpose of this video education is to provide the education and direction to my stakeholders for my clinical scholar project. The I have been a nurse before I became a nurse practitioner. I was a nurse, bedside nurse for several years, and I worked in medical surgical, and I also worked in a critical care unit, and both were surgical units. And during my experience, I was able to observe patients and the pain, post-operative patients for that matter. So my project is based on management of post-operative pain management, specifically on hip and knee, because the facility I plan to implement this project, hip and knee are the main surgeries being performed there. Okay, so let me start with defining pain. Pain has been defined by so many, and but I'm going to be using the definition by the International Association for Study of Pain. They define pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. There you go. So basically, tissue damage. That's what happens in post-operative situation. So, and also, it is very noteworthy to learn that worldwide pain management is an issue. 80% of the population, world population, does not believe that their pain is properly managed. And in the US here, almost the same thing about the post-operative patient. And out of the 80%, 86% said that their pain was 86. Pain was severe or moderate. So at this time, there's an urgency to really do something about pain management. So I'm going to be using my project is actually focused on using um, scheduled analgesics to manage post-operative pain in hip and knee replacement. I have personally witnessed the effectiveness of scheduled analgesics compared to PRN. When they say PRN as needed, that there brings a lot of issues. Some patients, based on cultural and religious reasons, do not call for pain medicine, and the nurses do not want to force patients to get pain medicine when they don't ask. Unfortunately, this patient pain go unmanaged, and then they are unsatisfied, and the complications that come with it has to do with all the systems of the body. So pain management is not only important just because we are nurses or because we are providers. It's important for human and economic reasons, because when pain is not properly managed among post-operative patients, they stay in the hospital longer than expected, and that's cost money and human suffering. So how do I plan to do this? To do this, I decided to tap on my stakeholders, and the stakeholders are five of them, five different groups. I have the anesthesiologist, the orthopedics doctor, the nursing educator, the surgical unit manager, and the nurses. So each of these group has very important part to play in pain management, and so I plan to provide them education. The education that I am going to be using educational theory and conceptual framework. The nursing theory that I selected is Dorothea Oren. This is a very popular nurse theorist, and it's been used in so many nursing projects. It's also actually be used beyond nursing. Her position is that patient education by nurses and the doctors helps the patient to understand realistically healing and rehabilitation process. So that makes sense. And then my conceptual framework has to do with promoting of action on research implementation in health care, in health services, for short, parish. So parish has been used previously to implement pay management. So I think this is why is the most ideal to pick. So it has to do with three factors. Parish talks about the evidence, collection of evidence, and he also talk about the context. That's the culture of the unit where I'm going to be implementing this, and it talks about facilitation, implementation. So all of these I already have them taken care of. The culture there is about evidence-based practice for two reasons. The unit has been suffering with patient satisfaction as far as pain. They've been getting very low grades, and also movement towards a magnet practice. So for that reason, the educator manager was very pleased that I picked pain as my project. So she has offered herself to be a champion of this project. Then so how do I, what is my educational intervention for my stakeholders? For the doctors, I plan to do quick face-to-face in-service with them from time to time. Could be 2 minutes, could be 3 minutes, 5 minutes, depending on their time. I don't plan to inconvenience them. I'll provide them the latest materials on pain management by the pain management guidelines, the 2016 guidelines. I have them. And also for my educator, nursing educator, she also told me that her door is open anytime I can come in. So anytime I have a article, evidence-based article, I will just verify with her. I'll give her some information, most recent information. So because I'm the one doing the literature search, getting all the information, so I will be updating her from time to time. And when I need her, I will be needing her sometimes to help me arrange or communicate with the nurses, especially those that might not buy into this project. But I've been able to talk to some nurses and they are willing to participate. Then the unit manager will be very important because she will help me with the location and schedule for the in-services that I'll be doing. And as for the nurses, I'm going to have do pre and post test questionnaire. I'm going to have quick workshops with them lasting 30 minutes to 1 hour. Again, I do not want to inconvenience any of my stakeholders for this. And also, I will be presenting them with a PowerPoint. Actually, I'm going to be trying the Skyscape because I can send them messages through that. That way, it doesn't interfere with their work sometimes. So then, what is my implementation plan? As fast as timetable, I I plan to finish this project, start and finish between 3 to 4 months. Of course, that will still be dependent on my chair. And then I also plan an additional tool. I plan to use the Cora and Cohen's organizational change steps. So having that in my mind, I'm going to be thinking, okay, what is the urgency here? The urgency is that we have to provide patient pain. We cannot wait any pain management. I mean, we cannot wait anymore for patient to be going through pain. And we also, I have already built my team, and I have a vision. My vision is to use scheduled pain medication, analgesics for that matter. I mean, to scheduled to manage patients post-operative pain. And also I've been able to get some nurses who have bought in, and my I've created short-term goals. My short-term goal is that the unit I'm going to implement it, we will be able to, within these 4 months, we'll be able to get going using the process or policy of scheduled analgesics. And also I will not give up because I do not expect not to meet challenges. I'm prepared for challenges, and with my leadership skill, I'll be able to overcome that. So the last thing is that I have to work beyond just implementation. I have to make sure that the changes are sustained. And the education champion has promised me this, that she will keep up with me and make sure that the the changes we are going to implement will stick. So I thank you so much. It's time for us to control pain, and I thank my stakeholders for taking this time to be beside me.